Good morning to my madam and my fellow friends. Our presentation for today's subject would be DYB 10042 Introduction to Biotechnology. Our today's topic for the presentation would be bioterrorism. There are many types of bioterrorism and we have chosen coronavirus or so-called COVID-19 for this presentation. The content of this presentation would be the introduction of group member, description of product, mechanism used to produce the product, significance the function of the product, the bioethical, biosafety and legal issues related with the products, opinion of fair judgment to the issue and conclusion. This is the introduction of group member. Me, myself as Lavanya Lakshmi, daughter of Satiswaran, Vaishnavi, Anna Perempuan Ilonggovan, Darshan Analaki Murgaya, Surya Darshini, Nur Naja binti Asmi. The description of product. Mass destruction weapons, which also include chemical, nuclear, and radiological weapons, are a broader category of weaponry that includes biological weapons. The use of biological agents is a significant problem, and there is an increasing chance that these agents will be used in bioterrorist assault. The SARS-CoV-2 virus is the infectious disease known as coronavirus disease. The majority of virus-infected individuals will experience a mild to severe respiratory disease and will recover without the need for special care. However, some people will get serious illness and need to see a doctor. A brand new severe acute respiratory syndrome coronavirus called SARS-CoV-2 causes the illness. It was initially identified from 3 pneumonia patients linked to the Wuhan cluster of instances of acute respiratory disease. The related coronavirus in nature have all of the structural characteristics of the novel SARS-CoV-2 virus particle. Serious sickness is more likely to strike older persons and those with underlying medical illness, including cancer, diabetes, cardiovascular disease, or chronic respiratory disease. COVID-19 can cause anyone to become very ill or pass away at any age. This is an example of poster or message for COVID-19. The virus can enter our cells thanks to the spike protein. They fit like keys into locks into receptors on the cell surface membranes. The virus can infect the cell if the key fits, if not, the virus cannot get in. This explains why, if the locks or receptors on their cells are sufficiently different, a coronavirus that can infect one type of animal may not be able to infect another species. The viral nucleic acids are contained in a protein shell called the nucleocapsid, which is either helical, tubercle in shape. One positive sense RNA strand makes up the whole coronavirus genome.
I'm Darshan from DBT 1A. My matrix number is 23 DBT 21F2004. I want to talk about the mechanism used to produce the product. A novel coronavirus strain was found in the lower respiratory tracts of 4 individuals who had severe pneumonia that had no known cause and was reported in Wuhan, China in December 2019. These clinical samples produced viruses whose genomes underwent deep sequencing analysis to determine the evolutionary history and sources of infection. Phylogenetic analysis of 2019 novel coronavirus, 2015 COVID genomes, and previous coronaviruses was employed. Interestingly, this revealed that the 2019 nCoV GenBank MN908947.3 shares about 90% of its nucleotide sequence with the bat coronavirus RATG13 GenBank MN900632, and that it shares 79% and 59% of its nucleotide sequence with the SARS-CoV BJ01 GenBank AY2784882 and the MERS-CoV HCV-EMC GenBank MH4542721 viruses respectively. It is impossible that bats are the houses of the 2019 CoV and that humans were exposed to it either directly from bats or through an identified intermediate host. Despite substantial sequence similarity, 2019 CoV genomes exhibited certain remarkable and conserved differences that had not previously been observed in beta coronaviruses. These standout characteristics which distinguish this from SARS-CoV and SARS the coronaviruses include numerous mutations in the RBDs of 5 proteins that may interact with ACE2 receptor, a polybasic furin-like protease site, RRARS, at the boundary of 51 or 52 subunits rather than the single arginine observed in SARS-CoV, and the addition of 3 predicted O-linked glycans.
Significance, function of the product. A virus infects your body by entering healthy cells. There, the invader makes copies of itself and multiplies throughout your body. The coronavirus latches its spiky surface proteins to receptors on healthy cells, especially those in your lungs. Specifically, the viral proteins burst into cells through ACE2 receptors. Once inside, the coronavirus hijacks healthy cells and takes command. Eventually, it kills some of the healthy cells. There is some evidence, though, that the Omicron variant doesn't attack lung tissues as much as other variants did. COVID-19, the illness caused by the coronavirus, starts with droplet from an infected person's cough, sneeze, or breath. They could be in the air or on a surface that you touch before touching your eyes, nose, or mouth. That gives the virus a passage to the mucous membrane in your throat. Within 2 to 14 days, your immune system may respond with symptoms including a fever, a cough, shortness of breath or trouble breathing, chills, sometimes with shaking, body aches, headache, a sore throat, congestion or a runny nose, loss of taste, loss of smell, nausea or vomiting, diarrhea. Some people also have symptoms including pink eye, rashes, liver problems or damage, heart problems, kidney damage. The virus moves down your respiratory tract. That's the airway that includes your mouth, nose, throat, and lungs. Your lower airway have more ACE2 receptors than the rest of your respiratory tract. So COVID-19 is more likely to go deeper than viruses like the common cold. Your lungs might become inflamed, making it tough for you to breathe. This can lead to pneumonia, an infection of the tiny air sacs called alveoli inside your lungs, where your blood exchange oxygen and carbon dioxide. If your doctor does a CT scan of your chest, they will probably see shadow or patchy areas called ground glass opacity. For most people, the symptoms end with a cough and a fever. More than 8 in 10 cases are mild, but for some, the infection gets more severe. About 5 to 8 days after symptoms begin, they have shortness of breath, known as dyspnea, acute respiratory distress syndrome (ARDS) begins a few days later. Dangerous blood clots, including in their legs, lungs, and arteries. Some clots may cause a stroke. Researchers are looking into reports of mouth sores and skin rashes, including reddish purple spot on fingers or toes. In general, children don't get as sick with coronavirus as adults do, but they can be infected and it can also be deadly for them. Some children and teens have been admitted to the hospital with an inflammatory syndrome that may be linked to the coronavirus. Symptoms include a fever, rash, belly pain, vomiting, diarrhea, and heart problems. The syndrome now being referred to as multi-system inflammatory syndrome in children, MISC, is similar to toxic shock or to Kawasaki disease, a condition in children that causes inflammation in blood vessels. We are still learning about these cases. The long-term effects of COVID-19 on your body are still unclear. Some patients have become what is being called long haulers, where they suffer symptoms for weeks and even for months.
Good morning, madam. My name is Sudadarshini, and now I'm going to continue with my question D, that is the bioethical, the biosafety, and legal issues related with this product. Firstly, I'm going to talk about definition of bioterrorism. Bioterrorism literally means using microorganisms or infected samples to cause terror and panic in population. Bioterrorism had already started 14 countries before Christ, when the Inters sent infected rams to their enemies. A biological attack or bioterrorism is the international release of virus, bacteria, or other germs that can sicken or kill people, livestock, or crops. Bacillus enteritis, the bacteria that cause attack, is one of the most likely agents to be used in biological attack. Bioethical of bioterrorism through the COVID-19. The COVID-19 pandemic has raised a host of ethical challenges, but the key among these has been the possibility that healthcare system might need the ratio scarce critical care resources. Returning policies for pandemic differ by institution, health system, and applicable law. Most seem to agree that a patient's ability to benefit from treatment and to survive are first-order consideration. However, there is debate about what clinical measures should be used to make that determination and about other factors that might be ethically appreciated to consider. In this paper, we discuss resources allocation and several related ethical challenges to the healthcare system and society, including how to define benefit, how to handle informal consent, the specific need of pediatric patient, how to engage community in this difficult decision, and how to mitigate concern of discrimination and the effect of struggle inequalities. The COVID-19 pandemic has raised a host of ethical challenges, but key among these has been the possibility that healthcare system might need restricting policies for pandemic differ by station health system and jurisprudence. Some states have uniform policy, while some systems and states have no policy at all. This presents an ethical challenge. In this arise when health systems reach the end of their capacity to handle the influence of patients during a pandemic. As a COVID-19 has spread globally, policies engage in clinical consultation and help development appreciate criteria for allocation decision. In this paper, members of a task force of the Associate of Bioethics Program Director reviews some of the difficult challenges facing clinical and health care system during the COVID-19 pandemic. This is not an exhaustive list of the ethical challenges arising during the COVID-19 of the pandemic. Rather, we focus on issues that are most pressing as the US approaches the first peak of this pandemic. Biosafety need, that is F5, that is detection, protection, restoration, conservation and treatment. In detection, they have food safety, bioterrorism and pathogen detection kit. For the protection, they have aeroscape materials, PPE and ecological environment, laboratory safety. For the restoration, they have two, that is oil water separation and biological investigation. The conversation, they have two seed storage container and sperm egg container. And the last is treatment, specific drugs, vaccine and disinfectant. The concept of biosafety has already been defined by the scientific community. It refers to the prevention and control of hazard caused by biological risk factors such as biotechnology and pathogen. However, these are two easily confused concepts. Biosafety and biosecurity. Biosafety is the prevention of the large-scale loss of biological integrity, focusing both on ecology and human health. It emphasizes the passive prevention and control of unintentionally included biotechnology and microbial biological hazards. In contrast, the biosecurity refer to a protective measure to prevent intentional biological hazard and often refer to areas such as national security, biological weapons, control, epidemic prevention management, food security and species invasion, although the two. Word biosafety and biosecurity have some subtle differences in meaning. Without special emphasis, biosafety is generally used. Therefore, during the in-term biosafety is used all substances section. The research purpose of biosafety is taking effective measure is again biological threat. The research area of biosafety covers a wide range of topics, including controlling infection, disease monitoring, biotechnology risk, ensuring laboratory biological safety, protecting biological resources, preventing invasion of alien species, defending against biological warfare and biological terrorist attack. Finally, the legal issues of bioterrorism to the COVID-19. Thailand has long established a law involving biosafety and biosecurity. The first of its kind, the Pathogen and Animal Toxins Control Act 1 was established in 1932. The main intention of the law was to protect public safety by controlling the use of vaccine and antivenom, as well as production, possession, sales, import and export of the pathogen and microbial and animal toxins derived from vaccine and antivenom production. The Act was revised in 1982 for a more appropriate situation in which the content involving the vaccines and the antivenom were excluded. Only the production, possession, sales, import, export and transit of pathogen animal toxins were under the control of Ministry of the Public Health. Penalty for offender were civil or criminal punishment, or both. The Act was revised further in 2013 with the key content excluding enforcers of the regulation for government agency. The government pharmaceutical organizing the Red Cross, which require only registration and notification of the works.
About opinion of fair judgment to the issue. If you have coronavirus disease and you are caring for yourself at home and you are caring for a loved one with COVID-19 at home, you might have a question. How do I know when emergency care is needed? How long do I need to isolate? What can I do to prevent the spread of germs? How can I support a sick loved one and manage my stress? Okay, so here's what you need to know. The first one is at-home treatment. Most people who become sick with COVID-19 will only have mild illness and can get better at home. Symptoms might last a few days. People who have the virus might feel better in about a week. Treatment is aimed at relieving symptoms and include rest, fluid, pain relievers. When you are sick, you need a lot of rest. But older adults and people of any age with existing long-lasting medical conditions should call the healthcare provider as soon as symptoms start. The factor put people at greater risk of becoming seriously ill with COVID-19. People with this condition who get COVID-19 may also be eligible for certain treatments. This treatment need to start within a few days after symptoms starts. And next, we can also take the vaccine as a protector for ourselves. The vaccine is effective to fight the germs that are in use and become antibodies for our body. Let us not consider this vaccine is something harmful. Always look at it from a positive angle in order to keep ourselves from exposure to the COVID virus. And the vaccine also will keep you healthy. When you are sick, the function of vaccine will help you to recover. And also vaccines are safe. Vaccine will not cause disease because they are designed to prevent. And the last one is vaccine preventable disease have not gone away. So don't scare to take a vaccine. That's all from me, thank you.
As a conclusion, coronaviruses started in 2019 and still affecting people in 2022 to the extent of having different variants. Coronavirus infectivity, spread and fatality has raised issues as a biological threat against mankind. This takes a brief review on the COVID-19 and associated issues with human diseases and biological threat to lives. SARS-CoV, MERS-CoV and COVID-19 are not only zoonotic but has devastating features against humans that needs attention. COVID-19 could be one of the biological weapon products, and there is urgent need for international bodies to address scientists and researchers based on bioethics and human rights, and as well encourage the healthcare givers for the task of managing and eradicating the pandemic and all forms of associated threats. The health crisis in COVID-19 reminds us that, unlike nuclear or chemical weapons, biological weapons are exceedingly difficult to locate and identify in adequate time to react to. COVID-19 is the biological agent or has inadvertently jumped the virus from the Wuhan province bioresearch facility. Biological warfare is a potential threat on the battlefield and in daily life. Healthcare practitioners to be familiar with biological and toxic agents that target the human system. Given the incubation time of many biological agents and their protein manifestations, it is likely that healthcare workers will be on the front lines in the event of a bioterrorist attack. That's all from our group. Thank you.